Hi, today we're going to talk about ejection fraction. And the first question is, what is ejection fraction? Well, that's how much blood the heart pumps out with each beat. And to start to help explain that, I'm just going to do a quick schematic of our heart. 4 chambers. The 2 bottom chambers are called the ventricles, and the 2 top chambers are called the atria. Right atria, left atrium, right ventricle, left ventricle. And when a doctor talks to you about your ejection fraction, they're often just speaking specifically to one chamber, which is the left ventricle. This is the main pumping chamber of the heart, and I'm going to draw it a little bit differently down here. And so blood enters from the left atrium, where it gets oxygenated blood from the lungs, and enters through the mitral valve into this area. And this is the main pumping chamber. It's very thick muscle, high pressure, and with that, each ejection or each squeeze of this muscle, blood gets ejected out or pumped out of the aortic valve, so it provides the circulation to the rest of your body. So when we measure the ejection fraction, we're really looking at this one chamber. And a normal value, which is important to know, is about 55 to 70% of all the blood that comes into that chamber with each filling cycle is then ejected out during the squeezing cycle, or systole. When we start talking about cardiomyopathies or weakening in the heart muscle, we kind of give different sort of severity classes. So probably the range 40 to 55 is very mildly reduced. 30 to 40 is sort of in the moderate range. And then less than 30, especially less than 25, is severe. And that helps us understand sort of how sick your heart is. The other aspect of ejection fraction is, how do we measure it? And we have lots of different ways in cardiology to measure it. And the different tests include echocardiogram. And that's probably the most common. That's a sonogram of your heart. And that we get a lot of great information from that. But one of the most important numbers we get from that test is the ejection fraction. Also, we can measure ejection fraction by a cardiac MRI. And that can be very accurate. Other times we get it if you go to the catheterization laboratory, and we can inject contrast dye into that chamber, that left ventricle, and then watch how it squeezes under a movie of your ventricle as it squeezes. So that's called ventriculography. The fourth way that we can also get it is during stress tests. If you use nuclear medicines to also are taken up into this chamber, and we can do real live imaging of that squeezing, pumping motion of your heart. So those are probably the 4 most common ways that we measure ejection fraction. And then, why is it important? Well, one, it helps us with diagnoses. It helps us know if there's something wrong with your heart muscle and its function. And so if we see a reduction in this LV ejection fraction, then we're concerned that something's wrong. There's a weakening of the heart muscle, and there's lots of different potential causes for that. Most commonly, it could be high blood pressure. It can be blockages in your heart arteries. It can be due to viruses that attack the heart. Also, certain genetic predispositions exist out there. So certainly diagnosis is an important reason why we worry about and measure the ejection fraction. Also, it helps us guide our management. And so when we see that the heart muscle is weakened by a reduced ejection fraction, we have a lot of different medications out there that we can treat and actually heal the heart. And with each measurement, we can kind of track our progress. Are we doing the right things to help your heart get stronger? Also, the ejection fraction becomes quite important when we talk about valvular heart disease. And when is the right time to do a valve procedure to fix that valve? And the ejection fraction helps us understand that timing. I think a lot of times when you get diagnosed with a cardiomyopathy and there's a lot of concern about your ejection fraction, I often tell my patients it's just one number. Even if it's reduced, 20, 30%, I have patients with those low numbers still have a very full quality of life, can do quite a few things that they enjoy in terms of walking, in terms of yard work, gardening. So just because you have been diagnosed with a low ejection fraction doesn't mean that that's not something we can treat and improve, but still have able to achieve a great performance of that heart in terms of your quality of life and what you can do, even if it's reduced. So it may be a concerning number that you hear about when you're diagnosed with it, but there's certainly things we can do to work with it. I just tell my patients it's just one number. There's a lot of other aspects of your cardiovascular health and performance that we worry about. So I think it's an important concept, and that it's important for you as a patient to know what is your ejection fraction. Doctors are really keyed into it in terms of how to treat your heart disease, and there's lots of great ways for us to measure it, and I hope this little talk gave you a better understanding of this concept.